Hey everyone, ever heard of chikungunya? It's a bit of a mouthful. But understanding this virus is super important. Especially with all the buzz around it these days. We're going to break down what causes it, what it feels like if you catch it, and what we can do about it, all from an expert perspective. But in a way that's easy for everyone to grasp. So, buckle up. First off, what even is chikungunya? Well, it's a viral disease, and the main culprits for spreading it are those pesky mosquitoes, specifically the Aedes aegypti and Aedes albopictus types. You know, the same ones that can spread dengue, yellow fever, and even Zika. They're like the tiny, winged troublemakers of the insect world. The name itself, chikungunya, comes from a language in Tanzania and Mozambique. And it means to become contorted. That's a pretty vivid description, right? It really points to one of the most debilitating symptoms, which we'll get to in a moment. These outbreaks pop up all over the place: Africa, Asia, the Americas, and occasionally, even Europe. Speaking of outbreaks, there's been a significant one recently, hitting Guangdong province in China. We're talking thousands of confirmed cases since late June 2025. It's actually the biggest outbreak China has seen. And it's not just China. Globally, since the start of 2025, we've seen about 240,000 cases and around 90 deaths across 16 countries. So, it's definitely something to be aware of. Now, let's talk symptoms. Imagine this: you get bitten by a mosquito. And then typically within 3 to 7 days, you start feeling off. The hallmark symptoms are a high fever. And, here's the kicker, severe joint pain. And when I say severe, I mean it can be so bad it makes you want to contort. Just like the name suggests. Beyond those two big ones, you might also experience muscle pain, headaches, joint swelling, a rash, overwhelming fatigue, and even nausea. While most people bounce back within about a week, that joint pain can linger. Sometimes for months or even years. This is what we call chronic chikungunya, and it's no fun. Serious complications are rare, but they can happen, especially in vulnerable groups like young babies, the elderly, or anyone with underlying health conditions. These complications can affect your eyes, nervous system, heart, and even your digestive system. It's also worth noting that chikungunya symptoms can look a lot like dengue or Zika, which can make it tricky to diagnose without proper testing. Moving on to treatment, and here's where things get a bit well. There's no magic bullet. Unfortunately, there isn't a specific antiviral treatment for chikungunya. The approach is all about managing those uncomfortable symptoms. So, what's the game plan? Plenty of rest, staying hydrated with lots of fluids, and taking medications like paracetamol, also known as acetaminophen, to help bring down your fever and ease the pain. A quick but important tip: avoid NSAIDs like ibuprofen until dengue has been ruled out, because there's a risk of bleeding. So, always check with a doctor. Prevention, as they say, is worth a pound of cure, and it's especially true for chikungunya. Since mosquitoes are the carriers, preventing bites is your #1 defense. This means using insect repellents that contain DEET, or picaridin on any exposed skin. Think about wearing light-colored, loose-fitting clothes that cover your arms and legs. And definitely try to steer clear of areas with standing water, because that's where mosquitoes love to breed. Sleeping under a mosquito net, especially if you're in an affected area, is also a smart move. And if you can, staying in air-conditioned or screened accommodations is a big plus. Now for some good news on the horizon: vaccines. Yes, we actually have 2 chikungunya vaccines approved in several regions around the world, like the UK, Europe, Brazil, and Canada. One is called Eshik, and it's a single-dose vaccine. As of July 2025, it's primarily approved for adults aged 18 to 59, who are at a higher risk of exposure, though there are some safety considerations for those 60 and older. The other vaccine is Vimkunya, approved for individuals 12 and older. These vaccines are mostly aimed at travelers, and they aren't yet widely available in the countries most impacted by chikungunya. But they're a huge step forward. If you're planning to travel to a region experiencing outbreaks, it's always a great idea to chat with a travel clinic to see if vaccination is right for you. They can also tell you about availability. There are also new vaccines, including mRNA-based ones, that are currently being developed, which is really exciting. While severe cases and deaths are rare, it's crucial to remember that babies, The elderly and people with underlying health conditions are at a higher risk. Another big picture thing to consider is how climate change and urbanization might expand the reach of these Aedes mosquitoes, potentially bringing chikungunya to new areas. So, staying informed is key. Thank you for watching my channel. See you next time.